Obviously, Neil, you've met with the Newtown Patient Health Forum this morning. What have you heard from them?
Well, I'm very disturbed to hear that Newtown is so lacking in basic health service facilities, because it's falling between every stool at the minute. Mid Wales is a sparsely populated area, and the general hospitals that serve Newtown are based in either Aberystwyth or Shrewsbury. And there's a further complication because we cross a national border to get to Shrewsbury, and it seems that Newtown is the kind of Cinderella of the health service in this area, and because of the centralisation of health service facilities into these massive general hospitals, the needs of smaller communities for minor injuries and for maternity needs and so on are simply not being met. Ambulance waiting times are also causing difficulties, and there are enormous problems which need to be addressed, but nobody seems to be interested in addressing them outside of the locality.
What are you going to do today after?
Well, I've suggested to Joy that we should put together a very short report which states what the fundamental needs are in this area which are currently not being met, and that we should go and see Vaughan Gething, who is the Health Secretary in the Welsh Government in Cardiff in the first instance, and see what he's got to say about how we sort these problems out. And it's no good simply going on as we are, where, as in so many other cross-border situations, you've got an English body unable to talk or unwilling to talk to its Welsh equivalent, and the patients, in the case of the health service, are falling in between. So somebody's got to get things moving, and if it takes me to try and do that, then I'm very happy to.
Thank you for coming today, because we wanted to talk to you about the health issues we've got in Newtown. Newtown, we feel it is really struggling with our health service at the moment. We're very concerned about the future fit thing that's going on over in Shropshire, which will have a great effect on us here in this area, because it means that they're looking about where they're going to put the A&E, and obviously we desperately need that to stay close to our border, because otherwise it means people have to travel a great deal further. We've got problems with public transport. People don't have vehicles in this area, so then that puts pressure back onto our ambulance services. So we really need them to understand and take a note that people from Mid Wales, from Montgomeryshire, need our A&E to stay in Shrewsbury, because it's vital for us, or people will die. The further we have to go, the worse the outcome. And you know, that's a major concern. If it's your family, somebody, your loved one, you want to be able to get the best for them.
Absolutely. And
you need them to be treated as soon as possible when there's a crisis. So we're just asking you now if you'll help us fight for our health service in this area.
Yeah, I can see that Newtown has really been the forgotten area as far as health service provision is concerned. You can understand the cost-driven decisions that have been made in previous years to try and centralise, ostensibly to make the amount of money which is provided for the health service go as far as it can, but you can't take these accountancy measures as being the be-all and end-all. The problem is that the health service is run as a top-down institution. There's not enough involvement on the part of the people who actually use the service, and we fought the last general election and indeed the Assembly elections in May on a policy of making the health service more democratic.